My name is Yeshineh Demerew. I'm a senior expert specialist in obstetrics and gynecology, and I'm a urogynecologist as well, working here at Hamlin, Ethiopia, main hospital in Addis Ababa. There are several organs in our body which do not communicate with each other, but are located now side by side. So each of them separately function. But when there is a fistula, these whole organs make a communication. For example, if we take the female pelvis is a basin, and within that basin we have three tubular systems. On the anterior side or on the front side, we have the urinary system, is a middle reproductive system, and is a posterior or behind, we have the gastrointestinal system. So each of them function, but they are located side by side and they do not have a communication. When they form a communication, then we say they have developed a fistula. So when we say an obstetric fistula, obstetrics is something related to childbirth. So obstetric fistula is communication created between these adjacent organs as a result of childbirth. Most of them can be diagnosed very easily by pelvic exam. The proper management and timely management of labor is the most important thing. So whenever there is a cesarean section, delivery facility and capability, you can manage those patients before it gets obstructed. It can be prolonged, but it might not get obstructed because of early intervention. The other thing is, if we find these patients as early as possible, like within the first days or weeks after delivery, we can put a catheter inside the bladder, allow them to drink adequate amount of water, and if there is a dead tissue, you can remove that dead tissue surgically, and provide some rehabilitation measures, nutritional, iron, and such kind of things, and treat them with antibiotics. It's said like 15% all obstetric fistula can be treated in this way. They can close spontaneously usually within 4 or 5 weeks. The rest require a surgical intervention because it is a hole. Depending on the location, on the number and the size of the hole, you can do a surgical repair and close the hole. So most of them have the childbirth, which was very prolonged and usually unattended, usually more than 24 hours, and then frequently like 2 days, 3 days, 4 days, even in some cases like 5 days or 7 days. So usually in the process, they lose their baby. The baby dies in the utero because of the prolonged labor and shortage of oxygen supply to the fetus. So a prolonged labor, a dead baby, and following that, usually after 3, 4, 5 days, they start to leak either urine or stool or both. These are the most common symptoms, but in very severe cases, they may have other symptoms as well, like inability to walk because of the compression on the pelvic nerves that supply the lower, and then ulcerations around the genital area, leading to scratching. What happens is when there is a continuous leakage of urine, people usually tend to reduce their water intakes, which means it causes concentration of waste materials in the urine, and it causes skin irritation when it is discharged. So thank you for giving me your precious time.